Hi, and welcome to What's Happening at Tri-City Medical Center. I'm Kellie Davis, and I'll be your host for this edition of What's Happening, made in collaboration with KOCT, North County's channel, and the Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local medical center and provide you with information on a healthy lifestyle. Joining us on our show is Dr. Karen Hanna, General and Bariatric Surgeon at Tri-City Medical Center, here to talk about the complexities with obesity and weight loss. Obesity, or rather unhealthy weight, is considered a disease, and not just a disease in itself, but one that lends to other health issues such as high blood pressure, diabetes, heart disease, infertility, shortened lifespan, increased risk of certain cancers, and many other healthcare concerns. It is on the CDC's top 10 list of most important health problems in the U.S., and it's rapidly rising disease. We welcome Dr. Karen Hanna to speak about this very important issue. Dr. Hanna, thank you for joining us.
Thank you. I'm very happy to be here.
I know we took you away for some patients, but this is really important stuff.
Yes, it is.
Well, first of all, I have never heard the term general and bariatric. What does bariatric mean?
Bariatric is basically weight loss surgery. So it's one and the same. Bariatric surgery is the same as weight loss surgery.
Okay, so $1,000,000 question, Dr. Hanna. Why is it so hard to lose weight?
That is $1,000,000 question. If we had perfect answers for that, we would solve the problem. However, it's very multifactorial. And first, we all know that there's a lot of external reasons in our country, such as the increase in fast food. Fast food is often cheaper than healthy food. Our increasing sedentary lifestyle, the increased use of computers, streaming, television, instead of activity. But there's now an increasing recognition that there's a lot of internal factors as well. And that's where we came to the conclusion that obesity is a disease. What we know is that people who are at an unhealthy weight have different genetics than people who are at a healthy weight. They have different hormone levels. They likely have higher levels of the hormone that make you feel hungry. They have lower levels of the hormones that make you feel full. They have some psychological reasons that play a factor that we're still understanding. We also know that people who are at unhealthy weight, when they go to the gym and work out, even if they do the same level of exercise, reach the same level of heart rate, their body does not burn as many calories as somebody at a healthy weight. There's an increasing interest in the idea that the body has a set weight that it thinks it's supposed to be at, and as you gain weight, the body will reset that set weight at a higher weight. So when you try to lose weight, the body does everything possible from making you feel like you're starving to burning less calories in order to keep that weight at that set point.
And I know there's compounded with, you mentioned going to the gym, but I know that there are so many diets out there. There's this diet, there's that diet. So which one should we be doing?
I get that question a lot, actually. So yes, there's all kinds of different types of diets. Some are low fat, some are low carbohydrate, some are high protein. Some actually have a balance of fats, carbohydrates, and protein and use point systems to help you keep your calories low. What we know is that they all have about the same effectiveness. In other words, if you do scientific studies, the average weight loss on any program is about 15 to 20 pounds, which is great. It's certainly a step in the right direction. However, for somebody who's already 85 pounds overweight or even higher, it's not going to get them to their goal. We also know that only about 10% of people who do any of those diets manage to take the weight off and keep it off in the long term. So they're not terribly effective.
So with all the diets that are out there, as a doctor, do you tend to recommend one diet or another, or I guess you can't do that, huh?
No, it kind of comes down to what people's tastes are. You know, people and what they're willing to follow and what they're willing to stick to, what program works best for them. So it's really up to the individual patient, because they all have about the same, like I said, about the same effectiveness. No one diet is better than the other. They just need to do it in a healthy way. They need to have routine follow-up, and it's certainly the best place to start. But again, keeping the realization that outside of a very few people, they're not going to be effective in the long term.
So when someone comes to you and says, you know, I'm thinking about having one of these many different kinds of surgeries, what is the first step that you recommend when someone's like, I want to get this thing off me?
Right.
What do you?
Well, first of all, surgery shouldn't be the first attempt at weight loss. There should be use of one of those diets that we talked about, an attempt at medical management. The other thing is that surgery isn't used for losing 20 to 30 pounds. There are criteria that are used to determine if somebody is a candidate for surgery, and that's based off of what we call a body mass index. Body mass index is a calculation of height and weight. You can do an online search. There's BMIs, we shorten it for. There's BMI calculators online where you can put your height and weight in and it'll calculate for you. If your BMI is 35 or higher and you have medical problems such as the ones we talked about earlier, diabetes, high blood pressure, then surgery would be a consideration. But for a BMI less than 35, then usually we go with a non-surgical route.
And in Tri-City, is it that are you seeing people as a referral to you, or are they actually coming in to you first when they think about this?
There's a variety of ways they get to me. They can self-refer. A lot of times their primary care physician will refer them to me. It kind of depends on their insurance, whether or not they can come see me, and have their insurance cover it. And then I do an evaluation on whether or not they're a good candidate for surgery, whether they meet those criteria, what's needed to prepare for surgery. And then ultimately the surgeries are then done at Tri-City Medical Center when we get to that point.
And we talked about the diets, and I know some diets actually use medications as well. So what is the position on using medications for?
Well, medication should be physician monitored. There are a number of medications that have been FDA approved for weight loss. They all have slightly different ways in which they work inside the body, but they ultimately decrease hunger and in some cases decrease cravings. Mm-hmm. So they're kind of an addition to a good diet, and an exercise program. The problems with medications is that they add maybe another 20-pound weight loss on top of diet and exercise. They do need to be used for long periods of time. They can be expensive if their insurance doesn't cover it. And ultimately, when they come off the medication, they're at high risk for regaining the weight.
Okay, well, thank you. We're going to be right back. We have Dr. Karen Hanna here, General and Bariatric Surgeon at Tri-City. We'll be right back to talk about surgery.
Tri-City Medical Center, a leader in advanced healthcare close to home.
I've completed 8 Ironman races until a ruptured herniated disc caused me debilitating pain.
I performed a successful microdiscectomy on Kathleen.
But I did not want to run anymore. I didn't want to risk pain again. After time, I needed an Ironman-sized dream, so I returned to triathlons.
I worked with Kathleen to help her regain her strength.
Thank you, Tri-City Medical Center, for your incredible orthopedic work.
Tri-City Medical Center, advanced healthcare for you.
Well, it's all finished. You have a beautiful car.
It's my pride and joy.
You take incredible care of it.
Well, you service it every 5,000 miles.
Well, it shows. But when was the last time that you had a physical exam?
Did you know most men take better care of their cars than they do themselves? Nearly 26% of men 18 to 44 years old in the United States do not have a regular source of health care. Make an appointment today to ensure you stay healthy tomorrow. This message is brought to you by Tri-City Medical Center, advanced healthcare for you.
Welcome back. I'm Kellie Davis, and we are here speaking with Dr. Karen Hanna, and we're talking now about surgeries for weight loss. So what kind of surgeries are out there for weight loss?
Well, there's several different kinds of surgeries for weight loss. The most traditional, or the one we've been doing the longest and still considered the gold standard, is the gastric bypass. There's the gastric banding. There's a somewhat newer procedure which is becoming more popular called the sleeve gastrectomy.
The sleeve
Gastrectomy.
Okay.
And then there's a little bit more radical surgery that I don't actually do called the biliopancreatic diversion.
I have to say that. The biliopancreatic
diversion.
diversion.
BPD.
I like that one, BPD.
And there's variations on that surgery as well. The three surgeries I do, like I said, are the gastric bypass, the sleeve gastrectomy, and gastric banding.
Okay. Gastric bypass is the one where
So in the gastric bypass, we basically staple and divide the stomach, creating a very small stomach, about the size of a golf ball. We take the pipes, we divide them, we bring up one pipe, hook it into that little stomach, and then connect the pipes farther down. So basically you're creating a very small stomach, so you eat little. You're also creating a diversion, that's the bypass part, where food travels for a period of time not getting digested until further down when it connects to the juices that come from the liver and the pancreas that help you break down and absorb your food. So you eat less, you absorb less. It's basically how it works.
Now, and then you said one with the gastro, one with the band, would say
There's
that
the
one?
gastric bypass, which we just talked about. Then there's the sleeve gastrectomy, which is basically we take out about 7/8 of the stomach, creating a long, skinny sleeve. Okay.
Is that are you referring to stomach as a sleeve, you mean?
What we leave behind looks like a sleeve. Okay, it's a long, skinny, about the size of a banana. Yeah, so it greatly decreases the size of the stomach. So that's the restriction part. And then it also takes out the part of the stomach that produces a hormone that makes you feel hungry. So their hunger goes way down because we're getting rid of a lot of that hunger hormone.
It's interesting because I watched a show once, and this woman, I believe she had the gastro bypass surgery, and one of the things she felt after she had it, she did lose the weight and everything, but she talked about the joy of eating. She used to really like to eat, and that had kind of gone away. Was that atypical, or do you find that?
No, that's fairly typical. There's a lot of psychological aspects both into, having the disease of obesity. We know that people who are an unhealthy weight, that there's a high prevalence of childhood trauma. So there's a certain aspect that goes into that. We also know that there's other eating disorders besides the one that we commonly know about, anorexia and bulimia. There's also binge eating disorder, night eating syndrome, hormonal eating. And those are all issues going into the surgery that don't necessarily go away with having surgery. So yes, while we greatly decrease the ability to eat a lot, what we don't decrease is that desire to eat a lot. And some people struggle with that. If eating is sort of a coping mechanism, they now have to find a different type of coping mechanism.
Well, so if they were coming to you, and I don't know if the right word is evaluate. How do you know
evaluate
that?
them for?
Yes, they have these kind of pre-existing mental issues around it.
Yeah, part of the process of preparing to have surgery for weight loss is we do require them to see a mental health provider. We also encourage them to continue to get counseling both before and after surgery, whether that be through a mental health provider. We also provide support groups so that people who've had surgery or are thinking about having surgery can get together as a group, talk about a lot of these issues, talk a lot about the coping mechanisms and other aspects of having surgery.
This is also another question that I have had I have some of these celebrity types, you've heard that they've had this particular, the gastro bypass in particular, and you see them, they lose all of this weight, and then you see them maybe a year later, and they're kind of going back up to a heavier size. So it's not an end-all, be-all.
No.
I don't know if someone's going to have the surgery. I guess this is the question. How can they prevent that from happening?
Right. There is, unfortunately, about 10 to 15% of people who have this surgery who regain a lot of their weight back. Everybody regains a little, but some people do regain a lot back. And that's where we stress that this is a lifelong commitment. Things that we know that make people more successful with this surgery is that they continue to count their calories, they continue to monitor how much protein they're getting, they continue to exercise, and they continue to go to support groups, and not just for the first year or two, but for the rest of their life.
And the surgery is safe, would you say?
Surgery is becoming safer and safer. It's certainly safer than it was 20, 30 years ago. But the surgery for weight loss is as safe as having your gallbladder out or having a hip replacement. So it's in the, while surgery is never 100% safe, it's certainly in one of the safer surgeries.
And has there been a case like someone comes to you and has the bypass surgery, and then they want to come and have like they are one of those people that gain that weight back, and they come to you, and what do you say to them?
Well, there's a long program for weight regain. After we do an initial evaluation, we check their laboratory values, we get them back into what we call the program, meeting with my dietitian, going through their diet, we get them back into the support groups, we look at their exercise level, we look at all the behavioral aspects to weight regain, and then we evaluate their anatomy. I haven't had any of my own patients come back with weight regain, but I've had them come from others so far. But I've had them from other surgeons, so we end up, doing tests and x-rays to see if their pouch is small enough, to see if they've had, their anatomy is appropriate.
So does surgery make weight loss easy?
It makes it easier. It takes a lot of that hunger and that starving feeling away after surgery, and makes it easier to lose weight. But it's still a lot of hard work. You still need to make sure you're getting enough protein. You still need to monitor your calories. You still need to come to support groups, and exercise is a huge key. So sometimes I feel that people are looking for that magic pill, that surgery, and then they'll magically lose the weight. There's still a lot of effort required to achieve a healthy weight even after surgery. And we do a lot of preparation. This is not one of those things you come in and say, I have a hernia, and in 2 weeks you're booked for surgery. There's a lot of education that goes into it. They meet with a dietitian multiple times. We do all those normal medical, evaluations that are required. But we do everything possible to make sure that everyone has the right tools to be successful after surgery.
Okay, well, thank you, Dr. Hanna, and we're going to be right back right after this.
Tri-City Medical Center, a leader in advanced healthcare close to home.
When I first came to San Diego and needed a doctor, I found Dr. Ferber.
That was 30 years ago, and since that day, Dr. Ferber has cared for Kathy, her husband, and their 2 children.
Our family has followed Dr. Ferber just so that we could keep him as our doctor. He's so compassionate and up on the latest health issues and advanced technologies.
Over time, they've dealt with some stressful medical concerns.
I don't know how we'd have gotten through our healthcare issues if it weren't for Dr. Ferber and Tri-City Medical Center.
It is my goal to empower patients and promote healthy living. It is an honor to be entrusted with their care. It's all about relationships. We are partners in their health.
Dr. Ferber has always been so accessible. You always feel like you're his only patient. He just really cares.
What I love most about my practice is that we become family.
Tri-City Medical Center, advanced healthcare for you.
Welcome back. We're here with Dr. Karen Hanna, has been joining us to speak about the services she offers through Tri-City Medical Center. And we're back, and we're going to pick up where we left off a little bit about surgeries. And if someone is interested in the surgery for weight loss, where do they go? How do they do it? How do they get to you?
Well, first they need to make sure they're a candidate for surgery. And that goes off of the body mass index we talked about before, BMI. And again, they can do an online search for a BMI calculator and put in their height and their weight. And if their BMI is 35 or higher, then they're certainly a candidate for surgery. The next step should be to talk to their primary care physician about it. Usually they'll need a referral to me. Sometimes they can self-refer, but that depends on their insurance. They need to check with their insurance company, make sure their policy covers surgery for weight loss. And then once all of that happens, then they come to me for an initial appointment or evaluation, in which we go over all the stuff we've talked about today on the show. I do a lot of education about the different surgeries and the pros and cons. And then we give them a checklist that we help them go through, which is things like getting labs, x-rays, making sure they're up to date with all of their primary care issues, such as being up to date on their pap smears and mammograms. We have them meet with a dietitian, so a specialist in diets, one that knows what the pre or the before surgery and the after surgery diet is. They have to come to a couple support groups so they get to meet other patients who've had surgery. So there's a number of steps that we take them through and help them with in order to prepare for surgery.
Well, the pros seem to be very, okay, I get the pros. What are you said cons. What would be a con to this?
Well, obviously we would review what the risks are from surgery, but each of the different surgery types have different advantages and disadvantages. So like the gastric bypass works best for people who have diabetes for a long period of time. The sleeve gastrectomy is slightly less risky than the gastric bypass, so that might be better for somebody who has multiple other medical problems. So we kind of review what the pros and cons of each of the surgeries are in order to make a decision which surgery is best for them.
So it's fair to say it really, again, it's a very individual.
Yes.
And it certainly seems to be a process. And are there special considerations for women in this?
Certainly. First of all, the incidence of being unhealthy weight is higher in women than it is for men, although there's an increasing number of men at unhealthy weight. In addition, on top of all the other medical problems associated with obesity, like diabetes, there's a high incidence of infertility in women who are at an unhealthy weight. Being obese can cause polycystic ovary syndrome, so that it becomes very difficult for them to conceive and have a baby. If they do get pregnant, then they're considered a high-risk pregnancy because there's higher risk of preterm labor, higher risk of miscarriage, higher risk of diabetes while pregnant. So there's higher risk to both the baby and the mom.
Are there other options for this to surgery, or other options to surgery, the surgeries that you listed?
Well, certainly we talked about diet and exercise, and then there's new treatments coming out that are kind of exciting. There's things called a gastric balloon, where we actually put a balloon inside the stomach. There's something else out there where it's a tube that goes in through your abdomen where you can actually pull out some of the food that you eat. But all those are, I know. Surgery to me seems like a much better option. But there are newer treatments coming out and exploring new avenues for weight loss besides diet and exercise and surgery.
So going to the balloon one could you give that to me again? What did you say you do?
So basically a deflated balloon is put in the stomach and then it's inflated. So you have a balloon in your stomach, which makes you feel full, and it makes it difficult to eat. So it's kind of a space occupying balloon, and it helps people lose weight.
And it's not considered surgery then?
No, it's a minor procedure to put it in and a minor procedure to take it out.
And I'm just curious, do you have to kind of go back and get a new balloon?
Well, they're good for about 6 months, and then People often continue to lose weight once the balloon's taken out, but yes, some people will choose to have more balloons put in. But there's a limited amount that you can, times that you can do that.
And it's been effective. It's
in the early studies, yes, it's been effective. So,
and the other one you mentioned about coming through the abdomen.
So there's a minor procedure where they actually put a tube straight into the stomach, and then what they do is shortly after they eat, they pull out some of the stuff that they've eaten.
Who pulls it out?
Them, the patient. They're taught how to do it. It's a special apparatus.
Wow.
Yeah.
That Dr. Hanna, I want to thank you for coming on the show today. You definitely have enlightened me about the various kinds of surgeries that you can have, and I so appreciate your time.
Thank you. Thank you for having me.
Our pleasure. You've been watching KOCT's What's Happening at Tri-City Medical Center. I'm your host, Kellie Davis. To watch past episodes or other KOCT programming, visit koct.org. Thank you for watching.